Why does a small prostate gland create big urinary issues? Imagine a tiny gland causing a big problem. That's what can happen with the prostate and urinary health. The prostate is a small, walnut-sized gland located just below the bladder and surrounding the urethra, the tube that carries urine out of the body. Its main jobs include producing seminal fluid and helping control urine flow by regulating the opening of the urethra. Usually, when men have urinary issues, it's because the prostate has enlarged, pressing against the urethra and blocking urine flow. This condition is called benign prostatic hyperplasia, or BPH. But surprisingly, a small prostate can also cause significant urinary problems, even though it's not enlarged. One common reason is prostatitis, which is inflammation of the prostate. This inflammation can happen whether the prostate is big or small. When inflamed, the prostate can swell or irritate nearby tissues, including the urethra. This swelling can lead to urgency, frequent urination, pain during urination, and trouble emptying the bladder completely. It's often caused by bacterial infections but can also be non-bacterial. Another factor is scarring or fibrosis inside the prostate tissue. If the prostate has had previous infections or inflammation, scar tissue can develop. This scar tissue can stiffen or distort the prostate and urethra, creating a kind of internal blockage or irritation that hampers urine flow. Even if the prostate isn't enlarged, this scarring can cause symptoms similar to those caused by a larger prostate. Problems with the urethra or bladder neck can also mimic prostate-related urinary issues. Narrowing of the urethra, called strictures, or functional obstructions can make urination difficult. These issues may occur alongside a small prostate and contribute to urinary problems. Bladder muscle problems are another cause. The bladder muscle, known as the detrusor, might become overactive or weak. An overactive bladder can cause urgency and frequent trips to the bathroom, while a weak bladder muscle might not empty fully. These bladder issues can lead to significant urinary symptoms regardless of prostate size. Neurological conditions like Parkinson's disease, diabetes, or spinal cord problems can also interfere with bladder control. These conditions affect nerve signals that tell the bladder when to store or releases urine, leading to symptoms that are unrelated to prostate size. From a prostate health perspective, it's important to understand that urinary issues caused by a small prostate are often due to inflammation, scarring, or nerve and muscle problems rather than mechanical blockage from enlargement. While prostate cancer can sometimes cause urinary symptoms, it usually does so by affecting the tissue or causing obstruction, which may not be directly related to the size of the prostate. If someone experiences urinary problems with a small prostate, a thorough medical evaluation is essential. Doctors might check for infections, inflammation, urethral strictures, or neurological issues. Treatment depends on the cause and may include antibiotics for infections, medications to relax the bladder or urethra, or other therapies. In summary, a small prostate can lead to big urinary issues mainly because of inflammation, scarring, or dysfunction of the urinary tract and bladder muscles. It's not always about size but about how the prostate and surrounding tissues are functioning. Always consult a healthcare professional for an accurate diagnosis and personalized treatment plan.